Is Miss Sheryl Lee Ralph. She is the award-winning actress, singer, and producer, and has made an indelible mark in this cause as well as many others. Ladies and gentlemen, Sheryl Lee Ralph.
I'm a woman, I am an artist, and I know where my voice belongs. I am an endangered species. And I sing no victim song. I am a woman, I am an artist, and I know where my voice belongs. I need you all to stand up for something, but especially to stand up for ourselves when it comes to this disease. This is the first week of Black History Month, and what is one of the greatest calls out for us in the new millennium? It is for us to save ourselves. HIV, AIDS is alive and rampant in our community because we let it be so. I stand here as a witness to 27 years ago. I was singing and dancing, having a good old time in the original company of Dream Girls on Broadway. And nobody knows what it was like to sing and dance next to somebody one night and to have that person sick, dead, or dying the next day. Nobody remembers what it was like when folks just started dropping dead of a mysterious disease. A disease with no name. What is worse is people don't forget how ugly they were to other human beings who died under a veil of stigma, shame, and discrimination. And worse than that was the deadly silence. Silence equaled death then, and silence equals death now. Because if we know did. Yeah, you think about that. You don't want to talk about that. The 68-year-old woman who realized after her husband died that sex had changed greatly since she was having sex with one person and one person was having sex with her. You don't want to talk about your parents having sex. Trust me, they are. Your parents and your children. And I used to be afraid for folks over 30. I'm not anymore. You've already proven to me that you think you know all about this disease, and you already know that you know it has nothing to do with you. You are wrong. Because you who think it has nothing to do with you, it's you. It's your family. It's your friends. But worse than that, I'm telling you, they're going to come out with a study soon, and they're going to tell you to your face, I'm sorry to say this, but it's your children. Your children are becoming infected in rates that are going to make you sit and think, how? And you are going to weep because you are going to say, not my child. It will be your child who will be infected in the most, what is supposed to be the most productive years of their lives. You don't want to talk about that, but you better get ready, because it's coming to you. Because you sat in your silence and let it be okay when it was gay men. Silence was wrong then. You sit and let it be okay now when it's women of color. It's not okay. Didn't pay attention quick enough, soon enough, humanly enough, Christianly enough, person to person enough. Now you're going to weep, because it is your children, and it's going to be your youngest of your young that's really going to make you cry. So get up, stand up, do something, and if you can't do that, get the hell out of the way. Species. I see no victim song. I'm a woman, a mother, a sister, a lover. My husband, Senator Vincent Hughes, thank you, honey, for joining me in this battle and this fight. I couldn't do it alone and without you. I'm your friend. I don't know you, but trust me, I love you enough to say the storm is coming. Like those tornadoes that hit those cities last night. Yeah, you're going to be standing there shaking, say, I had no idea. Yes, you did. The alarm went out. And just like the kids at the university, you said it didn't happen. It's not me. It's not really coming. It's here. It's in your house. It's in your neighborhood. And for those of you who don't know, for some of you, it's in you. All right. Yeah.
We're now going to open the floor up for questions. We'd like to start off with media first, and there are 2 microphones at the corners here, so if there are any media representatives that are here with us today that have a question, please come forth and state your question. Please tell us who you're with as well.
Hi, my name is Charlie Arnold. I'm with Sister to Sister magazine. I'm wondering, in terms of education, because I know that's the best way to prevent more cases of HIV. What age is the best age to target in order to educate youth, and how can this be done?
I think you have to start as young as you can when talking to them. I mean, we've gone past the point of saying, okay, 7th grade. 7th grade, they're 11, 12 years old. Trust me, it's already too late. too many of them are already infected, already having some sort of sex. Before that, I mean, you have to do it, and you have to do it in a way that's age appropriate. You know, the same thing a 3 to 5-year-old needs to know is not the same thing a 10-year-old needs to know, is not the same thing a 15-year-old thinks they know, is not the same thing that a 21-year-old needs to know. So we've got to start developing the scripts as young as possible in an age-appropriate fashion. When they ask you about sex, I mean, and they're 3 years old, you don't have to give them the graphic descriptions. You can talk about the birds and the bees for real. Because maybe that's all they need at 3 to 5 years old. So as early as possible as they're communicating to you in an age-appropriate fashion.
Okay, and also, I know in South Africa where HIV is, hugely prevalent, they use the edutainment model, where they have programs such as like Soul City and Love Life, that have like TV shows and radio programs that younger children are very able to relate to. Do you think this is a model that could be used in the United States?
I believe in the arts in this fight, don't I? And I have been trying to say for the longest time, we have got to get the arts truly involved in this. When it comes to people of color, we have always responded to the sound of the drum. We have always responded to the use of the voice. We have always responded to the movement and the dance of our body, because for some of us, that's all we had. So I believe that the arts must be involved in this fight. That, I think, is what's going to help us make a major change in how we reach certain parts of our audience that we've been missing before.
Anthony Moore, I pastor a church in Fort Washington, Maryland, in PG County. And I will be the first to say to you that the Black church has not responded appropriately. But I will also say to you as a pastor that in my community, the problem I have had is not that I couldn't get people lined up to get tested, because I'm one of those pastors who encourage the members to do it, and we do it at our church. The problem that I had is that I could not get the necessary government agencies to come to do the testing, and when they did come, they came with inadequate supplies for lines of people who were saying, I want to be tested. I like for you to speak to that, because I think the church gets a lot of criticism, and I don't mind, shouldering that criticism. But at the same time, our public health officials, who are paid by our tax dollars, has a responsibility to adequately staff themselves and have the budget that will sustain such a pandemic that we are experiencing with AIDS in our community.
Thank you. Who would like to address that?
The flip side, and this is just from my personal experience, I tour greatly across the country with my one-woman show. And we have gone to some churches that have invited people to come out and get tested, and the organizations will come based upon the past number of people who have come out to get tested. So when they come, when the government organizations come to some of the churches, they're coming with enough equipment based upon the numbers of people who they have engaged with in the past to get tested, because the church was not involved. So when the church comes up and gets involved, and you go to one of these super churches or these mega churches, and an enlightened man of the church or woman of the church says, get tested, and then 1,000 people show up, then the city is like, whoa, wait a minute. We've never had 1,000 people show up. I had that happen with, it was Enon Tabernacle Church in Philadelphia. My husband and I worked on a project there. 1,000 folks came to get tested. The government, the city was like, we have never had 1,000 people come out to get tested. We were in Texas. 2,000 people came up. Nobody was ready for that. Nobody was ready. Why? Because in the past, we have not shown up. We haven't shown them. So we have not shown them that we need to get tested. And they're not really aware of what a mega church is. Folks don't know what a mega church is. They're not ready for that.
I also want to